Seniors. If you're taking magnesium glycinate, there are 6 medications that could interfere with it, or even put your health at risk. We'll start with medication number 6 and work our way to medication number 1. The most important interaction you need to know. Quick disclaimer. This video is for educational purposes only and is not a substitute for medical advice. Let's begin. Medication 6. Antibiotics. Tetracyclines like doxycycline and fluoroquinolones like ciprofloxacin are commonly prescribed for infections such as urinary tract infections, respiratory infections, and skin infections. While antibiotics are essential for fighting bacteria, magnesium glycinate can interfere with their effectiveness if taken at the same time. Magnesium can bind to these antibiotics in your digestive tract, forming insoluble compounds that your body cannot absorb. This reduces the antibiotic strength and can prevent the infection from being fully treated. For seniors, this interaction is especially important because infections can worsen quickly, take longer to heal, or even become resistant to treatment if antibiotics are not fully effective. According to the National Institutes of Health, magnesium and similar minerals can significantly reduce absorption of these antibiotics. The good news is that this problem is easy to manage. Take your antibiotic at least 2 hours before or 4 to 6 hours after magnesium supplementation. This spacing allows the antibiotic to be fully absorbed while still letting older adults benefit from magnesium for muscle, nerve, and heart support. Even though the interaction is temporary, only during the course of antibiotics, timing matters a lot. Following this simple rule ensures your infection is treated effectively and safely without compromising your magnesium routine. Medication 5. Thyroid medications. Levothyroxine, prescribed for hypothyroidism, is extremely sensitive to absorption, and even small changes in timing can affect how well it works. Something that is especially important for older adults who rely on stable thyroid levels for daily energy and metabolism. Magnesium glycinate can interfere with thyroid medication by binding to it in the digestive tract. When this happens, the thyroid medication may not be absorbed properly, leaving hormone levels lower than expected. The result can include persistent fatigue, brain fog, unexplained weight gain, slower metabolism, and constipation, symptoms that are often mistakenly attributed to aging in seniors. Research, including studies in the journal Thyroid, shows that divalent cations like magnesium can form complexes with levothyroxine, reducing its absorption. Experts and guidelines recommend a simple solution. Take your thyroid medication first thing in the morning on an empty stomach with water and wait at least 4 hours before taking magnesium or other mineral supplements. Following this schedule consistently ensures your thyroid medication works as intended, while still allowing you to enjoy the benefits of magnesium for muscle function, nerve support, and overall health. By spacing these correctly, you can safely manage hypothyroidism without sacrificing your magnesium supplementation. Medication 4. Stomach acid medications. These medications, often called proton pump inhibitors or PPIs, include drugs like omeprazole and esomeprazole, which many seniors take daily for heartburn, acid reflux, or stomach ulcers. While they help protect the stomach and ease discomfort, they can quietly interfere with magnesium absorption. Research shows that long-term use can double the risk of low magnesium, especially in seniors or those also taking diuretics. By reducing stomach acid, PPIs make it harder for the body to absorb magnesium, even highly absorbable forms like glycinate. Without enough acid, magnesium may pass through the digestive system without entering the bloodstream. This isn't just a minor issue. Magnesium is essential for muscle function, nerve signaling, and maintaining a steady heart rhythm. When absorption is impaired, seniors may notice nighttime leg cramps, fatigue, or subtle irregular heartbeats, symptoms often mistaken for normal aging. The good news, this can be managed. You don't have to stop taking magnesium, but it's important to talk with your doctor. They may recommend monitoring magnesium levels, adjusting supplement timing, or reviewing your PPI dose. With the right plan, you can safely enjoy the benefits of magnesium without risking hidden deficiencies. Medication 3. Diabetes medications. Insulin and common oral drugs like metformin and sulfonylureas are taken daily by many seniors to manage blood sugar. While essential for controlling diabetes, they can interact with magnesium glycinate in ways you need to be aware of. Magnesium is actually very beneficial for people with diabetes. It helps your body use insulin more efficiently, improving blood sugar control. However, research published in the American Journal of Clinical Nutrition found that while higher magnesium levels improve insulin sensitivity, combining magnesium with diabetes medications can sometimes cause blood sugar to drop too low. Think of it like this. Diabetes medication acts as the brake to slow down your blood sugar. Magnesium adds extra braking force. When both work together, your blood sugar may fall below safe levels, a condition called hypoglycemia. For seniors, this isn't just uncomfortable. Symptoms include shaking, sweating, dizziness, confusion, and sudden weakness. In severe cases, it can cause fainting, which increases the risk of falls and serious injuries. The key to safety is monitoring and timing. If you're starting magnesium supplementation while taking diabetes medications, check your blood sugar more frequently, especially during the first 2 weeks. Any readings consistently below 70 milligrams per deciliter should prompt an immediate conversation with your doctor, who may adjust your medication or recommend timing changes. Medication 2, heart and blood pressure medications. Digoxin, beta blockers like metoprolol, and calcium channel blockers such as verapamil or diltiazem help seniors manage heart rhythm, blood pressure, or heart failure. While essential, combining them with magnesium glycinate requires caution. Magnesium naturally affects your heart and blood vessels. It acts as a natural calcium channel blocker, helping relax blood vessels and supporting a steady heart rhythm. This is usually beneficial, but research in the Journal of Clinical Hypertension highlighted that magnesium can amplify the effects of heart medications. For example, magnesium can intensify the blood pressure-lowering effects of beta blockers and calcium channel blockers, potentially causing dizziness, fainting, or abnormally slow heart rates. With digoxin, elevated magnesium levels may interfere with the drug's effects and increase the risk of dangerous heart rhythm disturbances. Seniors are particularly vulnerable because kidney function naturally declines with age, making it easier for magnesium to accumulate in the body and potentially reach toxic levels. If you are taking any heart medications, you should never start magnesium supplementation on your own. Instead, speak with your cardiologist. They can monitor your blood magnesium levels, adjust doses if needed, and guide you on safe timing. Medication 1. Diuretics, water pills. Loop diuretics, thiazide diuretics, and potassium-sparing diuretics are prescribed for high blood pressure, swelling, or heart failure. While effective, they can create one of the trickiest interactions with magnesium glycinate. Different types of diuretics affect magnesium in different ways. Loop diuretics and thiazide diuretics cause your body to lose magnesium through urine, while potassium-sparing diuretics can retain magnesium and even increase levels if you supplement. Studies published in Archives of Internal Medicine found that these differences can create serious fluctuations in magnesium levels. Too little magnesium can lead to muscle cramps, weakness, and heart rhythm problems, while too much can slow your heart, lower blood pressure dangerously, or weaken muscles. Seniors are particularly at risk because kidney function naturally declines with age, making it harder for the body to regulate magnesium safely. Before taking magnesium supplements, get your blood magnesium levels checked. Then work with your doctor to determine whether supplementation is needed, and if so, the safe dosage. Proper monitoring ensures you can take magnesium safely without risking dangerous fluctuations. Before making any changes to your supplement routine, please consult your healthcare provider. To keep improving your health and getting the most from your supplements, watch the next video. Every tip can make a real difference. And make sure to subscribe to get more tips to keep your health on track every day.